Hi everyone, it's Denise Dawkins, your favorite CPR, BLS, AED, and first aid instructor. Really quick video, hopefully. How you guys doing out there today? Today I have Ben. This is my guy Ben. Having a little trouble with this camera, y'all, but bear with me. Okay, so this is Ben, and Ben has a dialysis port here. Now, for those of you who are nurses or work in the healthcare field, yes, one should be red and one should be blue, representing the veins, the vein and the artery. But guess what? I'm improvising. So this is our dialysis catheter, dialysis port for Ben. Say hi, Ben. Hi. Okay. This is Jerry. So we have Ben and Jerry. Jerry has an access, we're going to say an access port. And Jerry is getting chemotherapy. He has bad veins. So he has a port. And this is out of the hospital. So we have patients in the hospital that have ports, who have dialysis catheters. But we also have them walking around every single day amongst us out here in the public places. Okay, because people go for chemo and they go for dialysis. Now, on Jerry, here we also have a medicine patch, a pain medication patch. This is Jerry's left side. I'm not sure if this is inverted, but this is his left side, and this is his right side. Now, these are the areas where the AED pad, which is what I'm talking about today, these are the areas where you'll put the AED pad on. So, right side and left side, right? This is very important for you all to know. You don't want to place an AED pad on top of a port area. You see that? Again, you don't want to place it on top of a medicine patch, and you do not want to place it, definitely not on top of a dialysis catheter port, right? So you know what an AED is for. This is what shocks the heart to get it to restart or re-jump so it can begin to contract and relax, pushing blood. Get it out of the abnormal rhythm, which is ventricular fibrillation. So the act of using the defibrillator is defibrillation, because you want to get rid of that abnormal rhythm, ventricular fibrillation. Now, you find these AEDs in restaurants, libraries. You'll find them hopefully in schools. Some schools do have them. You'll find them in the airports, in public places. And this is what we would use. This is a trainer to shock, to get rid of the abnormal rhythm. If you don't ever get rid of that rhythm, listen, the individual is going to die. So here we go again. Let me see if I can fix it where you guys can see. Okay, so this is the right side. This is the left side. The reason, again, for this, you do not want to place these AED pads over those areas. You get your AED, and you want to turn your AED on as soon as you get it. You want to follow the instructions. And so let me do that. Listen, I noticed that there is a medicine patch here, like I said, but I'm going to turn my AED on. This goes to the right side.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Right next to the catheter. Otherwise, it would be where? Probably over here a little bit closer.
Apply
so
pads.
Apply this,
plug in connector.
Making sure that it sticks correctly. This is going to the left side, the left lower side. But I have my medicine patch there, right? So I'm going to remove.
Apply pads.
I'm removing my medicine patch.
Connector.
You notice I used a napkin or a tissue. In the hospital, use a glove. Or if you run around with gloves in your car, use a glove. If you run up on a scene like this, you're going to apply the pad here.
Apply pads. Insert connector.
Make sure that
firmly.
It's sticking very well. And we're going to insert the connector here. There you go.
Analyzing heart rhythm.
All right. So this is what we look like.
Do not touch the patient.
It's not over the catheter itself. It's on the side of the catheter. And
Shock
it's here.
advised.
I remove, by the way, let me turn this off. let me turn this off, because in real life, when we're doing this, once it says analyzing, we're not supposed to be touching the victim with the AED going. So this is just for show. So I turned it off so you'll know this is not normal. You don't play around and touch an individual while the AED is still speaking or analyzing, in other words, okay? So you place your pad here on the left side, because that's where this belongs, where the medicine patch was. I cleaned it off and I placed it. And this where Jerry is getting chemotherapy. We placed it on the side here and making sure that it's sticking to the skin. As a matter of fact, maybe a little bit on the tape. We want it to stick on the skin, clearly on the skin, not on the tape, okay? So there you go. And it's still in a position where when the shock is given, the electrical current is going to be running straight through, or from the top of the heart to the bottom of the heart. So this is where you would place it, right? Of course, on a human chest, it would be a lot better in placing. But that's all I wanted to tell you. So it's the same thing for an individual with the dialysis port. All you would do is you would place this here, right here on the chest, making sure that it sticks totally and completely. You're not putting it over that dialysis port, right? And then you're putting the left lower one on the side here, on the left part. Now, if he had here on his chest, then we would shave the area. Get rid of the hair from the area, not the entire chest. Not up here, don't worry about here. This is an emergency. You shave the hair from this area here where you're going to be putting the pad. And then you place the pad on firmly. Okay? And that's all I have for you today. This is Ben. And this is Jerry. So my guys are going out, and they just want to say thank you for stopping by. And this is all I have to say to you today. Ben and Jerry. Come on, let's get a view before you get out of here. They're competing today, okay? Anyway, y'all, that's it. My name is Denise Dawkins. I am your CPR, BLS, AED, and first aid instructor. Sign up for a class if you need one. I teach family and friends CPR, infant CPR to new and expectant parents, BLS for healthcare providers, and for those who require healthcare provider certification, but it doesn't necessarily have to be American Heart. I am now aligned with ASHI. So for all your needs, I am your girl. Y'all have a great evening or a great Saturday. I'll see you all again. Thank you for stopping by. Have a good one.